First of all, welcome and thank you for taking time. I know all of you are busy. This is an important group, and convening the CEO Roundtable for NAATP hopefully will be a real value for all of you, and also will help inform NAATP as we develop resources and try to support our membership at large, specifically around the staffing shortage and that critical issue that we've been hearing a lot about at the association. Getting started, I'll go over a few logistics. We are recording this meeting. We'll make the recording available only to attendees, so it won't be made public. If you haven't already, please mute yourself while you're not talking. There are a lot of us in this room, 32 now, and if there's background noise, it's going to be pretty hard for all of us to hear. Please also rename yourself in your Zoom window. You can do that by clicking on the ellipses in your video, and then down at the bottom there's rename, and have that show your name and organization. As we get into discussion, if y'all are willing to raise your hand, you can do that either by clicking on the reactions button down at the bottom of the screen and clicking raise hand, or typing Alt-Y on your keyboard, and that'll raise your hand just to keep some order as we're moving through and making sure that people are heard. It'll be helpful if we can call on you with those raised hands. And with that, if we can keep sharing somewhat brief and on topic to our discussion, that'll be helpful. We want to make sure that we get to hear from all of you that want to share or have strategies and suggestions, and we'll need to move through kind of quickly. As I mentioned already, the purpose for this call is really gathering information, developing resources for our membership, and sharing strategies about how providers are addressing challenges related to workforce recruitment and retention. Y'all represent many of the more prominent leaders in the field, and we're hopeful that the information shared here will be valuable to this group and also really help us better support our members at large. We'll be talking about the three main areas of concern that were reported in the NAATP workforce survey. But before jumping into those, I'll give Marv a chance to share and kind of set the tone for this discussion.
Thank you very much, Peter, and thank you to all the NAATP team who put this roundtable together on short notice based on what is really an emergency situation in our provider centers. Welcome everyone, thank you for joining. As I look at the screen and see all of your faces, I called back to the original purpose of NAATP and its founding in 1978, which was at its most basic level, create space for leaders to come together and share their experiences and help one another. And so that is precisely why we're here today. There is nearly no substitute for CEO to CEO, C-suite leadership to C-suite leadership in the centers across the country. And you do indeed, as Peter said, represent some of the finest providers our country has, saving lives. And so what we have identified, and it has not been hard to do so, is that what was already a highly difficult and problematic situation dealing with COVID since March of 2020 and all that it brought to our families and to our programs, we certainly didn't expect, or I certainly didn't expect in October or November of 2021 that we would get worse. Thank you very much for that universe, but we did, in terms possibly short-lived in terms of the Omicron variant, although I understand there's a variant of the Omicron variant that's out there. You know, we will move past this phase, but what has been reported to us are pretty dire circumstances in terms of staffing and safety at treatment programs. And so that's what we're here to share information about today. We've gathered some resources that we'll share, additional resources that we'll share and post after the meeting. We just received a new piece of information a few minutes ago from the National Council for Mental Wellness, specifically directed at behavioral health work. So we have a lot of information to give you, but we are not here to lecture you today. To the contrary, we're here to hear what your experiences are under a set of questions that Peter will pose. Thank you all, by the way, for those of you who have who submitted answers to the surveys to move this along. So this is about hearing from each of you, learning from those experiences. From here, we will set up a webinar for a broader audience, and from there, we will set up a session at the national conference in May in San Diego to further this, because it's not going away. Before I turn it back over to Pete, I want to give you a couple of statistics that have just come out. 43 million Americans quit or changed their jobs in December. 43 million Americans quit or changed their jobs in December. That's down from November. That's down from November. So that's the trend that we've been on. And that statistic in and of itself says that this is not about Omicron. It is, but it isn't. There are currently, according to the Bureau of Labor and Statistics at this time, 11 million job openings in the United States. And that what we're experiencing at this point is job switching. The term job switching has become a phrase. And the three metrics that the Department of Labor and Statistics have measured that determine whether employees switch jobs are pay, benefits, and schedule. Probably could have come up with those if we'd have asked us one another, but that's what they are. So interestingly, the biggest job switching and the biggest job resigning is not in healthcare. It's in food service, accommodation, retail, and those areas. So we have a national environment in which we are a piece, a small piece and a unique piece, but we are a piece, and none of this can be managed without recognition of that. In the first 10 days of January, now Omicron, in the first 10 days of January, 9 million people missed work. And that's because of illness and family illness or the inability to go to work based on children's needs. So that's a backdrop for what can be discussed today. And I thank you all again. And I'll turn this back over to Peter, and he will give us instructions.
Thanks, Marv. And thank you to those that did respond to the workforce survey. That's really going to be the guide for our discussion today. There were three prominent areas that we had the most reports that our members were struggling with. And of course, there was a little bit of nuance to each of those. And so what we'd like to do is go through each of those individually and hear from you, maybe some of the nuance of your experience with that, what your center's facing related to each of those three areas, and then any strategies that you've found to try and address that problem at your facility. And again, that's really intended to try and bring value to this group and also inform us as we move forward and look at webinar topics and other resources for our membership at large. The first piece that is not going to be a surprise to anybody that was the number one concern from our members was finding and recruiting qualified staff. And some of the nuance with that and the complicating factors were competition from hospital systems, vaccine clinics, and the higher salary and benefit expectations from staff. So to start with, discussing what your center has seen with that and the strategies that you've employed to try and combat that challenge. And again, if people have things that they'd like to share, if you can raise your hand, we may be able to move away from that. But initially, if you can raise your hand in the chat, that'll help us keep it moving.
Looks like Brad is up.
Hey, good afternoon, everybody. Yeah, a good couple of questions, and you may have to just remind me which three they were, but I generally remember the theme of them. You know, what we've seen is different challenges depending on the category of employee, and so the strategies have been different based on the category of employee. So for your hourly employees, $25 an hour and below, EVS, housekeeping, VHTs, the competition for them has been pretty much any industry that is looking for hourly work. So distribution centers, big box retail, which had been willing to basically pay whatever they needed to pay to get bodies in the store. So places that Karen was not historically competing with for employees. We were losing people to places like Wawa, Walmart, even like the Acme distribution center right off 76. I think they were starting at like $23, $24 an hour with $1,500 signing bonuses. And again, it's mundane work. But for somebody, if that's an extra $6 an hour, that's a big deal. That's a lot of money for them. That might mean their spouse might not have to work. So finances were a big deal. We actually did about 4 rounds of market adjustments throughout the course of a 12-month period, trying to keep pace with that. And we also found that we had to do similar recruitment and retention bonuses to keep people on those teams in place. The other issue, though, that we found is that the quality and caliber and just personality of the employees are a bit different than what we've historically found. So even though we're still about, I would say in the BHT department in Pennsylvania, 12% staffed. It's probably a little bit lower than that if you just count the newer folks. They're just not as they're just not the same caliber, I would say, of the folks that we used to find. So that's been a real challenge. At your professional level, your clinicians, the proliferation of telehealth services has made your typical counselor far more portable. They can pick up and work from home and work for Talkspace or any number of these different outfits. And whereas agency work was probably the easiest thing for many of them for quite some time, this has become another option. So now we're competing with a lot of other employers and flexible employment. So we have been trying to figure that riddle out. I would say we have not yet quite figured that one out. We're probably working on some longer term initiatives, and it's not really all about money, I would say. I think this one's a much bigger picture of how do we collectively, all of us as organizations, make coming back to an agency, a brick and mortar workplace, appealing. How do we find components of the work from home, flexible work world and integrate that into the brick and mortar work world so that people don't feel like they are giving up on things that they got a taste of over the past 2 years by coming and working in a brick and mortar environment. So we're considering all sorts of things like non-traditional schedules, earning things like sabbaticals after certain lengths of tenure, and looking at polling our staff to see what kind of other creative benefits would they like to see us bring to the employment environment that would not only get people to come, but really more importantly, how do we get people to stay? Because the third challenge that I would say is people come, but now they work 3 years, get licensed, and then they leave. And for our organization, that's a big challenge because those tenured employees who stay 5, 10, 15 years in clinical positions have been such a critical part of the culture and the continuity of what we do. Did I touch on everything? That's probably enough for me, though, so I'll leave it there.
That was great. Thank you, Brad. I think next we have Tom Britton. And real quick, Tom, before you go, for anybody that missed the question, Zane posted it in the chat box, and y'all are welcome to use that for some side discussion as well as we keep moving through. I think that Tom had to drop off. So William Robbins, you're next.
Hey, everybody. Thank you for including me in this. Brad, we're finding similar things at Alina. And I think one of the things, there's some parallel, I think, to all the work that we do with our patients and students and clients and guests. It seemed like an acute response was necessary, right? So this is a shorter term. We turned our lounge in the family into like a spot for staff, and a place where they could kind of come rest. And what we found is this is a much more chronic problem that then has demanded different responses. So on the recruitment side, one of the things that we did was that we made health insurance available at 30 days rather than our traditional 90. So we thought that might be a way of recruiting new people. We have certainly had to raise the salaries of staff and crucial staff at various levels. I like the way, Brad, that you kind of differentiated. I didn't think of it in that way. I think across the board, and my head of my kitchen came in and said, I can make $15,000 more if I, left. And it's those non-traditional competitors, right? It's for us, it's the Target or the Stop and Shop literally is offering more money than our facilitators, our techs, and that's a very hard job. There's something nice about just going and checking out people in a supermarket. We have done retention bonuses. My board of trustees put up the first time through, put up $10,000 collectively. It's not a lot when you kind of break down the 85 employees that we have, but it was a gesture that was made, I think, was accepted and our staff felt thought about. There's the emotional piece too. So there's the, for us, it's the other piece of working here. And I think in almost every program, for all of us, there's the mission driven piece too. And how do you ask people to do more and more when people are out sick, right? So you want to take care of those folks that need to be home with a kid that's been exposed or a family member that's sick. Meanwhile, that means more work for those that are on our campus. And so we've tried to be flexible with those schedules. When it comes to vaccination, we chose to offer testing as an alternative to mandating vaccination. That's ultimately where we ended at. Governor Murphy just signed an executive order 2 weeks ago, basically mandating all healthcare workers now to be vaccinated, including boosters. So I'm dealing with some of the fallout from there, from the staff that just don't feel like that's appropriate for government to be reaching in and dictating that. So we just got slammed with the possibility of losing even more staff. And so that's some of the struggle that we have, probably same as everybody else, but it's definitely an acute response turned into a chronic response with some financial retention, flexibility, and offering some more things to folks on the way in to make it easier for them.
Thanks, William. And now Tom will go to you.
All right, sorry about that. And in full disclosure, I have 28 more hours as the CEO of Gateway, but today I'm the CEO of Gateway. We, like others, really struggle in general, like as a baseline. I think around retention in this industry is tough, and we have different business lines where the margins are very small because our mission is to serve both Medicaid and commercially funded patients. But one of the things we do annually is we track retention, we track turnover. And we hire Press Ganey to do an outside employee engagement survey. And we got our results this year in kind of the May-June window. And we're able to really use that to target specific areas of improvement down to the unit level. And what we saw in the first few months of the year, and our year is July to June, was higher turnover than we've ever seen. And we were on track to literally lose over half of our staff. And so in the 4-month period, really from kind of August through November, we implemented really dramatic initiatives, including across the board compensation increases, targeted compensation increases for people that were at high risk, very intensive communication strategies, and now we're trending under 40% turnover for the year. So we're really seeing kind of that impact period over period. One of the things we're watching very closely right now is, we had 4 identified COVID cases among our staff in November. And just for perspective, we have over 1,400 employees. In the first 2 weeks of January, we had over 90. And so kind of what was already a challenging problem, that rolling kind of outages of staff intensified everything that our staff were experiencing. And so one of the responses we took is to purposely close units and restrict access to care so that the staff that were on site were not dealing with the same census they would deal with before. We looked for targeted strategies to do work at home. We found ways to support them financially while they were out, and really kind of a comprehensive strategy. We did implement a mandated vaccine approach for all of our staff with an exemption option for testing, but we have over 90% of our staff who've been vaccinated. Only 91 total that chose not to. Interestingly, 50% of them have gotten COVID in the last 4 weeks, whereas about 7% of our boosted staff have gotten it in the last 4 weeks. So really kind of reinforce that. But the benefit of that is the staff that are vaccinated who are going for much shorter amounts of time and having much less severe symptoms. And so we see that really as kind of one of the return on investment strategies for us about improving employee burnout. The next 4 to 8 weeks is when we're going to really try to ramp up, or I should say, Greg Dawkins, who's on the phone, and the rest of the operational team, will really ramp up the ways that we engage our staff through communication, through support initiatives, and further evaluating compensation increases. Thanks for letting me share.
Thank you, Tom. I don't see any other hands raised for this question. Do others have insights or experience in recruiting staff, especially with the increased competition?
I don't know how to raise my hand, so I'm doing it verbally, sorry.
Go ahead, Jim.
So we're running into a fair amount of that here. We have, I think, similar to Alina Lodge and Karen and some other facilities, and I know Bobby Ferguson certainly faces this, we're in a resort town. And during the season here, we had hotels paying housekeepers $40 an hour. And so it's very, very challenging, obviously, to compete with that. And for hourly employees, we've always offered at Harmony a very full benefits package. We pay 100% of medical care for folks. And at the hourly rate, that often does not matter to people. I found it's much less of a draw than I would hope. We do a 401k match. We have PTO and 9 floating holidays, and people just want to know what they're making. And try as we have to educate people about the entire package, it's not happening. And our struggle in this too is people left to work at the local hotels, and then when the season ended, they wanted to come back and work here. And in normal circumstance, we would say thank you, but we know you're going to leave again in May. But today we can't do that. Like everyone else, we've done multiple market adjustments for people. Some of it we just had to do some recent ones because we're finding to get interest, we have to start at a higher pay for people coming in. Brad recognized this, but we're getting people with less and less experience coming in to start who need more supervision, which is a drain then on our supervisory team. So I think it's a similar thing. Marvin started out talking about the general numbers of people. And this past week here in Colorado, we had a winter symposium in Colorado Springs, and happened to learn from the folks at the Broadmoor, which is a massive organization. They have 1,200 openings currently at the Broadmoor Hotel. So this is not something that's unique to us. And they're running a similar situation to a residential treatment program, and where they have to have people there 24 hours a day taking care of things. So it's a tough proposition for everyone. We've tried to get more creative. You can't do nursing remotely, but you can do family program or case management. You can't really, although we have, and to Tom's point, we have a couple of our clinical team who have opted out of getting vaccinated, and they've done some individual sessions while other people have picked up group in order to keep them working while they had to quarantine during exposures. We've been pretty lucky, but we know that that's just today, but this could always change. I think our hardest piece right now is around recruiting. We've done a fair job in keeping our folks. One of the things that we did was that all of our executive team and our senior leadership pick up what, for lack of a better word, would be entry-level jobs. I'm regularly working Monday morning as a tech because we don't have enough techs to cover all of our shifts. So I come in at 5:30 to open our women's program. Our director of facilities works as a housekeeper from time to time. Our senior leadership team all took turns behind the food line, dishing out food to folks to show that we're part of the solution. But it's tough, and I'm not sure how long I can keep senior leaders if part of their job, their other duties as required is cleaning toilets. And so that's been a struggle for us. Thanks.
Thanks, Jim. Next, we have Joel Johnson with Task, and then after that, Jim Calder.
Yeah, thank you. As I'm listening and reflecting on some of the struggles that we're having, we just had an all-staff meeting and we shared organizational demographics. We have a workforce that is about 73% female. We have total 5 generations in the workforce. And so we look at ways of strengthening our benefits package. It's really looking at kind of a cookie cutter approach because as was previously indicated, we sweeten the pot on some benefits. Really the bottom line hourly rate is what a bulk of the staff are interested in. But our, baby boomers and Generation Xers are like myself with weak knees and a rickety back are more interested in the benefits and the health insurance optimization than we are looking at that hourly rate. And so we're really caught at a quandary where we try and figure out how to satisfy all of the workforce. About a third of our total budgeted FTEs are vacant, which is about 70 positions statewide. And our revenue is really centered around expense-based contracts. We provide predominantly case management as a service. And so our contracted partners, it's not in most cases, a billable, insurance billable revenue, but is based on expense-based contracts. And so revenue optimization is not really under the current contracts are not really possible. And so sweetening, targeting retention bonuses and things of that nature is what we're working towards. We did just give a budgeted raise of 3% in this last fiscal year. Immediately following the raise, of course, the next all-staff meeting, the question was, when are we going to get a raise? And so it's kind of a cycle of change we're chasing. As we recruit 3, we lose 4. And so we are beginning of the fiscal year, we're net a net loss of about 15 positions from June 30th. But we have a constant flow of new employees. And so it's an interesting quandary we're in, and we need to grow. You can't cut out of these types of scenarios. We need to grow revenue, which means we need to grow business. And so everything from mergers and unfortunately going after new contracts and expansion of services is a challenge because again, we don't have the workforce to service the innovation and new business. And so we have to be very careful and strategic about what that growth looks like.
Thanks, Joel. We have Jim next, and then Paul and Debbie.
Oh, thank you. I want to thank you, Marvin and team, for hosting this gathering. It's very, very informative and instructive. I don't think our experience is very different from what everybody else is seeing on the ground. It's a very, very difficult environment to attract people. You have a lot of open positions. People are moving for very small differences in economics. So we're doing many of the same things that you all are talking about. But I would just encourage everybody on the call. Each of you are part of a unique community of people who are passionate about what we do, and I think it's very, very important for us to emphasize the community of our individual teams. I found in my work career that people will stay with you if you do a couple of things, and that is one, we need to emphasize the missional aspect of our business. We're doing very, very important work in restoring human beings, and I think we need to continually remind our teams that they're involved and engaged in that work. And so there is something unique about what we do. I also think it's important, especially with the hourly people. The best thing that we can do, nobody's going to get rich working for us in an hourly position, but we can show them on a daily basis that we appreciate what they do and that they are involved in important work as well, because everyone who is on the team is making a contribution towards our ultimate goal, which is trying to restore people. So I think it's important for all of us to be out and about and in front of our people. You know, we're always struggling to find new people, but sometimes we don't pay enough attention to the people who are already with us. And so it's a difficult environment. If it was easy, anybody could do this, and it's not. But anyway, I appreciate each of you and for what you're doing at your teams. I know it's a struggle in many aspects for all of us, and so I do like the idea of all of us being together in this cause. So anyway, thank you.
Thank you, Jim. That was great. And I like the different tone on some of the strategies, recognizing the staff that's already there and being out front. Paul, Alexander, I think that you're up next.
Yeah, thanks, Peter. Sorry, I can't get on video right now. I'm outdoors, but this has been a great discussion, and I don't want to, be redundant. We've experienced very similar trends at Northbound. And there's two things that I would like to emphasize that we've done to find staff and retain staff. The first is we actually started a recruiting arm, and this was in the beginning of last year, and focused heavily on how to recruit the right staff rather than posting jobs or word of mouth or things like that. We actually really refined our recruiting strategy for the open positions. And then secondly, and again, that's a separate enterprise, a separate company from Northbound. I mean, that's how serious we got about it. And we also have been able to help some of our strategic partners in the field place positions. So that's been a lifesaver for us, keeping a healthy workforce and filling positions. And then secondly, one of the biggest things we just continue to focus on, and it's always been a strategic initiative of ours, is the organizational health and the culture. When staff come to us, we want them to be well-trained and crystal clear on our mission, our vision, and our values, and provide and develop an environment where they feel appreciated, they feel encouraged, and there's enough trust and safety within the organization that they can come forward and discuss their personal life and their professional challenges. So that culture that we've developed has been a retention tool like I've never seen. I mean, even if folks can go down the street and get a couple more bucks an hour or, even more, they'll stay with us because they appreciate, the culture at Northbound and the ability to work on a team that fosters their personal and professional growth. And we're in Orange County, California, so there's a pretty big pool. Nurses specifically have been the biggest challenge, I'll just say, because of the options at the vaccine clinics and hospitals and whatnot, where they can get significantly more money. So it's been a challenge in our detox unit to keep nurses specifically. So I just wanted to add, my experience, and appreciate everybody listening. Thanks.
Thank you, Paul. And we'll move over to Debbie Sanford with Pine Grove.
Good to see everybody today. Thank you. Our experience has been very similar to everybody else's, and we're part of a large hospital system, but have still lost a tremendous number of nurses. We're struggling every day with nursing staff, both at Pine Grove and at the main hospital. But I wanted to ask about physicians and those that are the providers in the organization, if you're having struggles with that as well. We're certainly seeing that from psychiatry, they can just go home and work via telehealth, and it's very difficult to recruit physicians right now. So I wondered if you were using more mid-level providers like nurse practitioners, PAs, that kind of thing, and if they were doing more or having more involvement in the programs than maybe they had in the past, where you had limited their involvement and still had a primary physician that was doing most of the care, or certainly the documentation on the psych evals or the initial evaluations and that kind of thing, if you were using more mid-levels for that. Thank you.
Thank you, Debbie. Is there anybody that would like to touch on that topic before we move on to our second piece from our agenda?
I mean, Debbie, I can just tell you, we're in a small town. We've actually had more MDs coming to us because they wanted to get out of the emergency care that was in the small rural hospitals. And they thought there'd be less exposure around COVID here. So we've actually had the opposite experience. Psychiatrists, exact same experience. But yeah, that's been a little bit different for us. So I'm sorry that I'm taking a little bit of solace in your experience, that I feel better. But
if you could send me one to South Mississippi, that'd be great.
I'll see what I can do for you.
And I'll just say that yes, we do use a good amount of mid-levels, and they're fantastic at providing most of the services that we need. We do want oversight from physicians, so we are actively seeking a couple, one a psychiatrist and one a medical doc. But yeah, mid-levels can be really productive and wonderful practitioners.
Thank you.
Thanks. And Debbie, we can include some of that in our follow-up surveys and send you some information, or people on this call can follow up with you directly to share what they've been experiencing with that.
Okay.
I think now we can move on to our second point. Many of you already touched on this, talking about staff recruitment and retention, but the secondary problem that we saw reported in our survey was staff engagement, burnout, fatigue, and secondary trauma, with a number of contributing factors. A few of you mentioned staff being out sick, increased duties for existing staff. And so how your organization has been working to address the staff burnout piece and fatigue and the staff that you do still have. Cameron?
Thank you again for this forum. I'm joined today with Jane Barnes, who is the COO of Park, and I absolutely feel the pain from everybody. I started this progression at an Acadia healthcare facility as COVID came across, and now I'm continuing this journey with Discovery Behavioral Health that just recently purchased Park. So these topics are very close to home because we actually did an acquisition during this process. And so where we would normally see attrition and turnover from a traditional acquisition standpoint, it was once again in the middle of a pandemic. What we have tried to do is it's, as I keep running notes, it's almost like a checkbox. We've done that. So I really appreciate that all of us are feeling the same pain. And a couple of things that we've been doing is, looking at opportunities where we can provide some simple, incentives. That is like daily staff meals in lieu of staff that would normally have to pay for daily meals out of our cafeteria. Doing allotments where they get free meals and things of that nature. Sometimes that goes a long way with somebody, and sometimes it doesn't. We've actually just issued out some branded logo jackets and things of that nature, that just trying to use creative means for those. Once again, they appreciate the gestures and something that builds that kind of ethos and that team mentality. But also some people also have the, well, if they spent money on this, why couldn't they just put it in my paycheck? It's like every time we try to focus on doing something, you know, it's like we get 50% of the population, and the other 50%, unfortunately, is something that we still have to retain creative. One thing, coming back for the previous topic, which was somewhat unique here in Houston and at the park, is we didn't have a hard time finding nurses. Ironic or not, some of the nurses that were coming to us were so burnt out from the med surge mentality, and were excited to come into our arena because they had experienced what we're talking about on this topic elsewhere, and to come work at a mental behavioral health institution was a lesser frustration than covering a COVID unit, and they were almost at that mindset where we're tired of the COVID pain, we're tired of seeing patients sick and loved ones sick, and so we actually kind of had a reverse effect of burnout from med surge, and we're able to capture some nurses. And then unfortunately, we were able to capture some individuals that left from smaller facilities that were furloughing or laying off. And we were able to maintain a structure under the Discovery Behavioral Health umbrella of full staffing. And so I wanted to touch base on this topic because it's ironic. We're actually seeing some positive from staff engagement, burnout, and fatigue from other arenas that are finding recourse with us. And then much like our colleagues had referenced before, it's then maintaining that engagement with those staff members that have been loyal and allegiant throughout the years, and making sure we can meet them one-on-one with their needs. We're at a point now, we're discussing, as I shared at the start of the call, you know, we're in a weather advisory, and I know those that deal with snow and inclement weather, you know, we're Texas, and last year we have PTSD from that, but we're coupling that as we go in through the week, and we're actually looking at some opportunities potentially to have, you know, family setups where, you know, individuals are having still a hard time with daycare and things of that nature, and maybe looking at an opportunity where we can help offset that for our staff just to get bare bone coverage. So it's kind of ironic. When I saw this topic, I was like, man, we're actually benefiting from that from other entities, and I don't know if anybody else is feeling that, where smaller facilities that have had to close or med surge burnout is actually a benefit to your organization.
Thanks, Cameron. Are there others that have experience or strategies around working with staff and improving their engagement? See your hand, Greg.
Yeah, so just to name a couple of things quickly that we're doing. We have seen a real difficulty with recruitment, but our engagement, I mean, our retention has been pretty good. So we started with the things that Paul and Jim were talking about, and really going back to our mission values and opening that communication up more. We're kind of putting more emphasis on that. I think that has had an impact. But just a couple of other things that we were doing. They're timely. We were planning on doing them anyway, but they have been effective. One, having a true staff wellness program. And so we've started that now, but offering a variety of different actual interventions, such as, you know, AccuDetox, you know, bring on massage, having Zumba class, you know, thinking about support groups, you know, care for the caregivers kind of stuff. We also have started an internship program, and that has been pretty good. One, because it will, you know, create a group of people who are looking at Ashley and know Ashley and then want to come and work here. So that's been in the works for a little while, but I think it also takes off some of the pressure of work because they help run groups and all of that. So I think, you know, building an internship program and expanding it if you already have one could be beneficial. And then also we have a curriculum for staff. So we actually developed a curriculum to educate. And this goes back to the idea of personal development. So we're putting a little bit of emphasis on each individual and saying, how can we have you, when you decide to leave Ashley, be better than when you came in? And those efforts have certainly helped with retention. Again, recruitment has been very tough.
I'll step in. One of the things that we've done at Park that I really appreciate is that we have been supportive of those of our staff who are out sick. And I think it, you know, every week I'm sending flowers to somebody, whether it's because they're homesick or because they have a family member who is homesick, and just letting them know we're here for you. If you need anything, please let us know. We've also had meals sent to staff who are homesick with COVID, and just wanting them to know that they're missed. And we've done all of the things that y'all have mentioned, including, you know, stepping in to clean a room or do a group or all of that. We've all had to play different parts. And one of the things that I've really appreciated with being with a larger organization and a team is we've had to share employees. We've had employees from our Austin facility who have come to Houston to help out. And we've had some of our staff from Houston go to our Austin facility or California to help out. And so really not just only working as a team here at Park, but through our whole organization. And that's been very supportive.
So Nikki just sent me a note and a reminder, but one of the things we've done, we did this with techs, we do it for our nurses, and we're looking with other departments, is more flexibility around scheduling. So some of our techs are now working 312s, and we provide housing for them on campus, because most of our folks have about a 40-minute to an hour drive to get here. So that allows them to be here for a couple of days and leave. We do have the ability, because the property used to be a resort, to have some housing for staff on campus.
Thanks, Jim. Jay, I've seen your hand up for a little bit here.
Yeah, so I'll make a couple of comments. Greg's comment about interns triggered me to respond to, and that really is in reference to the first question, but a while now we've worked with a local university. What we found is that there's a lot of people that get their master's degree in counseling and related fields, but often their experience around addiction is not very robust. And so we partnered with a local university, helped co-write the curriculum for 3 addiction classes, and we agreed to take a certain number of their interns, and so that's created a pipeline for us of people that can assist, learn about Cumberland Heights. We learn about them. They don't all come to work for us, but some have, and like Brad, some are staying for now, but then some get their license and then they move into private practice, you know. So it's kind of hard to tell which one is going to go in which direction. Another piece of that was we were able to negotiate a tuition reimbursement discount of 25% for our staff to go to that university. So there's a little bit of a two-way street there. We're actually looking to see if we can expand that to a second university in our area. Now, having said that, I've got open positions in my counseling staff, and I also have more turnover, so I have a little less longevity than I used to. But it's so important. I used to have 2 associate clinical officers, and one, she is basically working full time now to try to do supervision and training and internships and that sort of thing to expand that pipeline. It's that important. I would agree with a lot of what's been said. My CFO sent me a posting in a rural part, an adjacent county to Nashville, and it was a posting for dish heroes, paying $18 to $20 an hour. So a dish hero is what we used to call a dishwasher. And so it's not just us. I think it's a macroeconomic problem. I think 1 out of every 350 Americans is dead. And so some of those were in the working population, and that will not be readily replaced. Immigration policies have tightened up over the last several years. So we have fewer immigrants coming in to take jobs. So there's some macroeconomic issues in play, plus just the Feds, stimulated the economy, the government stimulated the economy, and it's running hot. And we need a good recession before we will see this ease up. And some of that's tongue in cheek, but it is a little bit of a wage inflation spiral because, we've done salary adjustments. Another thing we did is we typically do merit raises at anniversary dates. We moved everybody up to January in order to accelerate that. So if you're going to get your raise in May, you got it in January, and hopefully that will help hang on. You know, that's a trick you can use one time. So, you know, I don't know what I do come July, you know, if I'm in the same boat, but it sounds like we're all in the sort of a little bit of the same situation. And I want to say, I thank NAATP for providing the forum today. I just want to make a comment on that. I appreciate that opportunity.
Thank you, Jay. Dave, we'll move over to you.
Hi, everybody. Good afternoon. Thanks for hosting this. And Jay, you know, you got those liberal politics. I got spots in Madison and Chicago open for you if you want to come up north with us and share some of that. And I agree, recession, we always do better staffing in a recession than we do right now. I had the advantage of taking over Rosecrans pre-staffing crisis, and so I was full of piss and vinegar and had all sorts of ideas with our employees growing up in the company the past 30 years. So our satisfaction rates are the highest they have been in 10 years, these last 2 years during the pandemic. And our retention rates are higher than they've been. Here's the weird math. Our turnover rates are also higher. And so I am not the smartest person, pulled in our team, and they said our retention of most positions are very, very high. Nurses and direct care techs are just churning nonstop. And so that's a weird anomaly that we have. Our best source of referrals right now are our employees, and we use this high satisfaction. And we did a lot. I mean, I told you guys last year, we did a $6.5 million pay increase. We moved everybody to 50th percentile by region. You know, we did the merch, as someone was talking about there. Jim, I really appreciate your comments, because I think that's what I probably tried to do most, is just connect with people. You know, I started as a minimum wage tech and training 30 years ago. And so I have that experience, which adds credibility. So we took all this, and then I sent a message out to the staff and said, well, look, if you guys like it so much, tell your friends, and we'll give you $2,000 if they come in. And then if they stay 6 months, we'll give you another, I think it's $2,500 after their anniversary. And I've been amazed at how many referrals we have from our employees. And that's our best marketing. You know, no matter how much we brand and advertise and whatever, when you have one of your buddies say, hey, go work at Rosecrans, it's a good place to work, it really makes a difference, and that's helped us. I think the last piece before I sign off that we did is, you know, I am grateful for our boards of directors who said to me, hey, Dave, we're going to get our rear ends handed to us. Don't worry about money right now. We got money in the bank. So let's get through this pandemic and be safe. And so when Omicron hit, we were just where we needed to be. You know, we have 1,400 employees. We had 70 employees a day getting sick. It just ramped through Iowa and Illinois and even to Wisconsin. Myself included, second time. I'm a 2-time survivor, fully vaccinated, boosted, all that. But to say to our employees, we're just not going to fill beds, which we hate, right? People are dying from this disease, but we're just not going to fill beds. We're going to keep them open. We're going to hold them. We're going to keep our outpatient groups open and make sure that you guys are taken care of first. That meant something to our employees because they realized they were more valuable than our bottom line. Now ask me in a year if this shit keeps up, I'm going to run out of savings, so it won't be so heroic at that point. But right now, day to time, right, and it's working for us. So thanks again, everybody, for sharing so candidly.
Thank you, Dave. Jamie?
Thank you, and thanks everyone for all the work that you're doing and for all the suggestions. I don't have anything unique or different to offer other than we've really engaged our alumni and in terms of recruitment. And although alumni may not be ready to come in, or they're in a different state, or they may not be eligible to be employed, they know someone and they have had a good experience with us. And so we have offered a modest stipend to alumni that refer someone for hire, and then a second when they are there after 6 months. So That's the only different thing. And again, we did do recruiting on the same what you said, Cameron. We recruited at nursing homes and ICUs for nurses, and that worked well too. So thank you.
Thanks, Jamie. Unless anybody else wants to jump in quickly on this one, I think that we can move on to our third piece, which again relates to some of what y'all have been talking about these last few shares, which is reimbursement rates not keeping up with inflation and the increased costs of treatment centers. And so if people would like to share on how they're dealing with that, that was a really common theme in the survey, that insurers are not increasing their rates and there are much higher costs for employing staff and COVID tests and those kinds of things. And Rick, I see you right away.
I was struggling with getting the hand raise thing going on there. But I just wanted to comment on Jamie's comment about incentives. We've offered an incentive program to our employees to help identify crucial positions that we need to fill. And it seems to have worked with a limited amount of success, but I didn't want to belabor that point. I think everybody's covered pretty much the crucial elements of this hiring situation. Jim's point about getting in front of the people that we have and making sure they realize that they're valued. I think that's important, to try to be proactive to make sure that we're providing a culture that folks want to work in. I think a lot of what is happening in this the Great Resignation is that people they don't appreciate the companies that they work for, or they don't feel appreciated, and the cultures that they're working in, they feel in some cases are toxic. I know in our business, if we're not careful to nurture a healthy and healing culture, that it can be problematic for a lot of people. And I've seen that happen around the country as programs have evolved and have suffered programmatically. So not only do patients suffer, the staff suffers. So anyway, I don't want to say any more about that. We can move on now.
Thank you, Rick. Does anybody have experience or strategies around the differential rates in reimbursement versus inflation and increased costs?
Hi, this is Carl Kester, Lakeside Mom Recovery Center. So as others have said, thanks to everybody for taking the time today. That may be something that I entered into the survey, so I think I'll speak to it. And I'll start with not my favorite thing, which is discussing my failure as a negotiator. Primera Blue Cross said it covers 40% of lives in the greater Seattle area where I'm located. And they have, after lengthy negotiations, offered us a 1% increase on detox rates. And the fact that in the marketplace, they're at their lowest renewal rates are 18%, based on what we know is low utilization for them. And we laid out for them our budgeted plans. I apologize, somebody said it earlier, which has been our strategy, which has been across the board increases partnered with targeted increases, will be a 12% increase in our personnel budget next year. And their response was, that's significant, but not relevant to our conversation today. So I don't know, one, I'm seeing heads shaking the wrong way or the right way, I guess, but I don't know if anybody's had any luck using that information, and or if that's something that we might be able to partner with as an association to make a point. I actually haven't seen the current, whether or not the insurance companies are releasing yet what their utilization looks like. I know it was down last year. I don't know if people have started going back up to healthcare. The governor is not allowing optional healthcare in Washington again. So I'm kind of meandering now, but I'll sign off. But that may have been tied to what I was talking about.
Thank you, Carl. I'm not sure if you were one of the people that I saw, but there were definitely multiple people who brought that forward. So I'm hopeful that some others can talk to it. And I see Alex is off mute.
Yeah, I don't have a great deal of experience with this. We're in this process now. So a lot of our multi-year plans already had 3 and 4% increase ladders kind of built in. So we weren't good. We tried, and those payers weren't interested in giving us any more. Part of our appeal was the cost of living adjustment that Department of Labor put out. I think it's at 6% now. Like that's how they rated it. So we tried to make a case for 3 versus 6. Didn't have a great deal of success, but we're digging into it now. So if we find anything, we have any success, I'm happy to share it with everyone. I think it's possible to do some kind of coalition building, but it's a real challenge. Just when you consider the geography and just Blue Cross, different branches. But that's all I can share. I have to hop off. It's again, I just want to thank Marvin and everyone for bringing us together. This is really helpful. Certainly happy to, Greg and I are more than happy to talk to people offline and explore some of this stuff more. Just a little shot of optimism. Our staff vacancy peaked in November, and it's like around 15% now, so it's improving. And we're trying to put all of our energy into retention, and so much what was shared is what we see as a winning strategy. So just stay safe. Great being with everyone.
Thank you, Alex.
I could just speak to the insurance question. I don't really have anything to add to all the other topics. We're doing many of the same things and have, but as far as the negotiating, Carl, we've been 10 years without an increase from the Excellus Blue Cross Blue Shield, and people at the board meeting at NAATP have heard me complain about it. We finally got a different regional director, and so we put again another comprehensive communication together, citing the history over those 10 years, all of the efforts, the kind of excuses that came back to us of why they wouldn't provide an increase. And the new president responded to me immediately and then gave me the name of the person that was going to be working with us. And we're now 3 months later. I'm still waiting for the counter proposal to come back. And they've already said that it won't be what we've asked for. And one of the questions they did ask, though, was about outcomes. And I was able to speak to what we do internally. I was able to speak to the nonprofit CEO group project, and I was able to speak to the NAATP Force project. They seemed thrilled. They were so interested. And we do have visibility on the website with those outcomes. So I was really hoping that that was going to get us some traction. I think it may help, but here we are, 3 months, and they're talking about, gee, they really get impacted by COVID and they can't review all the data. And I just wrote back and said, 10 years is 10 years. It's like, it's not complicated from my perspective. But so we might finally see something, but it's insane. We've added all these costs over 10 years, and then COVID dramatically the last 2+. And really, they don't care. And they've got the bulk of the market here, and they're not very receptive to moving. So I don't know what it's going to take. I'm hopeful that we're going to at least get something, and they made a promise that they would look at it more regularly in the future. I certainly will try to hold them to that. But it's a real difficult, they hold the cards and it makes it difficult. So that's all I got. Thanks.
Thanks. Yeah, and I would just chime in. I also very, very appreciative of the group and everybody sharing. I think, and I said this to some folks the other day, commiseration certainly has its place and is validating in a lot of respects. And there's really nothing I can add to the conversation of what's been shared. I appreciate some of the ideas. I've been furiously taking some notes. I don't know who was it said that I was shocked to hear that there was a hotel paying housekeepers $40 an hour. I was wondering if they were still hiring. I mean, but for the insurance, we've seen some varied outcomes here. We've got a couple of new negotiated contracts with some sliding scales with reduced rates over a couple of years. One of the big things that happened here in North Carolina was Blue Cross and a couple of the big carriers created these narrow network plans with big hospital systems in the state. Here in North Carolina, Duke University, University of North Carolina, Wake Forest Baptist Health, big teaching schools. that have these networks built around them. And so these narrow networks, employers buy these plans, and the people who carry who got the plans can only go to these providers. The plan is supposed to provide all the care available, but none of these places offer inpatient substance use treatment, and few of them offer outpatient service. And of course, we're excluded from those networks. And so we've been having some arguments and conversations with Blue Cross and Cigna, a couple of other carriers, with Optum, to try to get us, how can we break into these narrow networks? Because it certainly excluded people from care rather than included folks from care. We've got a couple of value-based contracts around detox levels of care. And frankly, in my opinion, and this is really not my bailiwick so much, but because of their misunderstanding of how we do detox and transition people to different levels of care, we were beating the metrics when we signed the contract, which was fine on my end, and they seem to be happy with that. So that's going forward. Probably the best news is that we just got a network with Bright Healthcare, which is a new insurance carrier that's entering the market here in North Carolina. Great rates, and they were easy to work with. And to Kathy's point, we did have some outcome data as well that they were happy to look at and seemed interested in. And I don't know how much it swayed them, but I signed that contract this week. So, adding a payer to our mix is certainly beneficial. And they did some one-offs with us over the past month while we were waiting to get the contract. So that was good news, but it's frustrating, and just like everybody else, the salary adjustments, and we, with some of the PPP money that we got over the past year and a half, we did a couple of COVID bonuses that the staff here was really overjoyed. There wasn't a lot of money. We gave everybody $1,000 across the board, but it was generally appreciated. And I also am a fan of keeping focus on our mission. Our last employee satisfaction study, about 96 or 97% of the people supported our mission, and that's a good number. And so keeping that forward, I want to believe is helpful. And I'm trying to keep that in front of us. We've had a tough week on them, I'm telling you, and a rough 6 weeks or so, like everybody else. So this group is helpful, and I appreciate being part of it. Thanks.
Hey, Marvin and the NAATP staff, I really appreciate you bringing us all together. Our CFO and I are pretty new to this field, and so just spending more time listening to you has been really helpful for me. I don't have anything original to share with you about how we've dealt with turnover and retention. The only philosophical variation is that we recognize that people are going to be leaving the organization for jobs they've been hoping for a long time or working toward, or for better pay. And we just want them to, when they look back at their time with us, to remember that we took good care of them. So, we've modified our benefits a little bit. We've adjusted pay. When we issued bonuses this last December, we accompanied each with a letter from their leadership, which described the attributes and the characteristics that we admire most about those people. And that seemed to have sort of an amplifying effect for the bonus. We also have a counselor and training program, which has been a good source of talent for us as our counselors have moved on to other opportunities at time, and as the peer support personnel have moved on. We extended the COVID pay. Some of you probably applied for that, so that when people burn through all their personal pay and sick leave, or personal time off and sick leave, there was a tax break in this last year. We've decided to continue that benefit, and we've had quite a number of employees that don't have any PTO, sick leave. So if it weren't for that, they wouldn't be earning a paycheck right now. We also have the recruitment bonus, or the referral bonus. We haven't offered it to alumni, so that's a pretty clever approach, but we do offer it to our current employees, and that's been a really good source of acquiring talent. We just entered into contract negotiations with one of our insurance companies. It's a local company that was started locally. So it's a good place for us to experiment with the strategy that we're going to use, where we emphasize a growth in the residential reimbursements rather than detox, because recognize in the long run that'll gain us a little more in reimbursement. And we're working with a consultant who has much more experience than the CFO and I have in this sort of thing. So he's holding our hand as we enter into those negotiations.
Thank you, Pete. We have about 15 minutes left, and maybe shifting topic, I'll put a number of resources in the chat feature, and then we can also include links to those in a follow-up email. Marvin suggested that we can use this group as a sort of listserv and reach out to each other to strategize or share resources and ideas or ask questions. But shifting the topic of this, I'd be curious, for those of you that are still on the call, sharing some of what NAATP can be doing to support you and also our membership at large. That'd be really valuable for us.
You know, there was one other thing I was going to mention, Peter, and your question is perfect for this. We have seen an increase in patients leaving against medical advice or against clinical advice. So any resources that are available that could help us look through our systems and our processes to see what we could be doing differently would be very helpful.
As much as the ideas from my peers are appreciated, the data is very helpful. So both inside our field and outside our field, you know, sometimes we've got our head down doing what we're doing. So things that come to mind is, you know, like insurance utilization, what is going on throughout healthcare, and how, you know, what employment stats are like, not only throughout healthcare, but other comparative industries. One of the things that's been very useful to me over the last 2 years is the banking partner we have employs an economist, and he's done a weekly newsletter. And so we've been able to track unemployment in other industries throughout the Pacific Northwest, which is Washington, Idaho, and Oregon. And just to have those and actual statistics of people deferring healthcare and statistics of how much people are going to restaurants or hotels, and then seeing what compares. So I would just throw out a request for any and all data, and then to continue to build the bridge that where we can, you know, bring our members together to work collectively on things.
Peter, where are we in our cycle on the salary survey? I know that'll be must-read material when it comes out, and we've got better engagement with each one. Are we back up on that in 2022? Is that a year we'll be doing this?
It is, and before I answer your question, one of the links that I just posted in the chat is for the 2020 salary survey. We recently made that available for free to all of our members. And so if you haven't seen that, you can go into our website. If you log in, you'll be able to access that. Going back to your question, Bobby, we're starting the process of launching the 2022 salary survey, and have added a number of sections into that related to staffing turnover, COVID impacts. And we hope to be releasing the survey for completion to our members at the beginning of March. There's a little bit of flex with that, but it'll be coming out fairly soon before the conference. Marv, I see you unmuted.
Well, I've never been around this group before who was for any moment in time at a loss for taking up all of the time. But I think we've had a really, really good conversation, Pete. Thank you for leading it. Thanks to everyone who contributed. As I said, there's a certain value in just the collegiality and the coming together. That doesn't carry the day, of course, entirely, but we've benefited as a staff from hearing this information and moving forward. Carl's comment about not just, but having the data so that individual providers can look at that and interpret it for their own needs is a really valuable thing. So we can continue to collect a little bit more of that. We can even combine our forces perhaps with a couple of our sister organizations and see what we come up with. So it seems like we've worn everybody out, and if that's the case, we'll follow up, as Peter said, with some materials and encourage us to stay together. Another benefit of this is it starts something, and this is a pretty impressive group of people to be dialoguing with. So let's see if we can keep that going.
Thank you, Marv. Thanks everybody for attending. I think that we can go ahead and end. There's a survey that will pop up when you close out the window. It's 4 questions long. It'd be great if you responded to that. And we'll follow up next week with a link to the recording of this session and then some of the resources we discussed. Thank you all.
Thanks,
Thank you.
everybody.
We
Staff,
appreciate you.
on for a minute, that'd be great. Thank you, everybody. We appreciate you. Nikki, you could scoot. Don't worry about us.